Namaste, dear listeners, and welcome to your favorite time of the week with the podcast that's far from boring, the Bored Backbenchers. I'm your friendly guide through the maze of medicine, Krishna, and joining me on this wellness adventure is the Oracle of Pharmacy, Dr. Deepthi. Today, we are illuminating a topic that could revolutionize your medical expenditure and your health as well as your medical bills. We are diving headfirst into the often overlooked yet intriguing universe of generic medicines. So, fasten your seatbelts, and it's going to be a knowledge-packed ride. Boom!
Namaste friends, indeed Krishna, we're all set to demystify the world of generics today. Dispel some myths and reassure you that choosing the off-brand option when it comes to medications is not just safe, but can be a safe, smart choice.
Couldn't agree more, Deepthi. Now, before we dive in, let me clarify what I mean when I say generic medicine. Generic medicines are essentially the copies of the brand name drugs, which carries the same drug substance, dosage, intended use, effects, side effects, and the route of administration as that of the same drug.
Picture it like this. So, you have got your favorite brand of Parle-G biscuits, and then you see a store brand version right next to it on the shelf. They may not be wrapped in the same shiny packaging, but they have got the same ingredients and taste, just as good, if not better.
Wow, brilliant analogy, Dr. Deepthi. Now, let's address this burning question. Many people have this question. I have thousands of people ask me in person. Why are generic medicines less expensive than their branded counterparts? It's really quite simple. The companies which are making generic drugs doesn't have to invest as much in research and development as the branded companies do. They are essentially standing on the shoulders of the branded drug company, benefiting from their groundwork and piggybacking on the company's research which was already done by the branded company.
Right, here, Mr. Krishna. It's like baking those Parle-G biscuits we mentioned earlier. The original brand did the hard work of creating the perfect recipe, while the generic version just followed the recipe to make the same delicious biscuits.
And that's not all. Here is the game changer. Because of the competition between the generic drug manufacturers, the price of generic medicine is often significantly lower than that of branded versions. We are talking about savings that can go into thousands of rupees, thousands.
But now, you might be thinking, okay, I get it. They are cheaper, but are generic medicines as safe and effective as branded drugs? Well, the answer is a resounding yes. Generic medicines must meet the same strict standards of quality, safety, and efficacy as their branded counterparts. They are reviewed and approved by regulatory authorities like the CDSCO, which means Central Drug Standard Control Organization in India, before they can be sold.
Great. So, now that we have established what generic medicines are and how safe and effective they are and how they are cheaper than that of branded drugs, let's go and shatter some myths around that.
Myth number 1. Generic medicines are inferior in quality. First aid. As we mentioned earlier, generic medicines must meet the same strict standards of quality as branded drugs. The CDSCO ensures generic drugs have the same quality and performance as their branded counterparts.
Thanks for that, Deepthi. Here I go with myth number 2. Generic drugs take longer to work. Busted again, that's wrong. Generic medicines have the same drug and are formulated in the same way how the branded drugs are made. So they won't take much more time than the branded ones to work.
Going to myth number 3. If I'm taking the branded drug, I shouldn't switch to the generic version. Busted. In most cases, it's perfectly fine to switch from a brand name drug to its generic equivalent. However, we should always consult with your healthcare provider before making any changes to your medication regimen.
Yeah, that's for sure. And finally, myth number 4, which we see from most people, which is only the original drug manufacturer knows the secret formula. So generics can't be exactly the same as branded drugs. No guys, I'm sorry, but that is busted again. Generic medicines are required to have the same drug as that of branded drug. So the secret formula isn't so secret when it comes to active ingredients, because when the patent is expired, the information is available to the public. And the patent will be available only for 20 years. Once the patent period is done, a branded drug can be made as a generic.
And let's not forget the pharmacy of the world, as we lovingly call India, has been a key player in the global pharmaceutical industry, known for its high quality, low cost generic medicines. We have been providing affordable medicines to millions of people worldwide.
Absolutely. I'm very proud of what we are doing. And I'm also proud being an Indian and contributing a lot from our side to the whole world. In fact, a significant landmark was the Indian Patent Act of 1970, which allowed our local firms and pharmaceutical manufacturing companies to manufacture the generic versions of patented drugs. This move propelled, or let's say catapult, India to the forefront of generic medicine industry.
And it's not just about the money, folks. It's about accessibility. Yeah. Generic medicines, with their lower cost, enable more people to receive the treatment they need. They are a vital part of ensuring healthcare for all.
So, the key lesson is, the next time you are at the pharmacy, remember our chat today. Yes, don't be swayed by the shiny packaging of branded medicines. Consider the humble generic medicine too. It might be just a smart choice for your health and also for your purse.
Well, that's a wrap on today's episode of the Bored Backbenchers. We hope you have enjoyed the enlightened journey through the world of generic medicines, and maybe we have helped burst a few myths along the way.
Yeah, I'm sure we did, Deepthi. And guys, don't forget to consult with your healthcare provider before making any changes to your medications. Stay informed, stay healthy, stay hungry, and stay foolish. And until next time, this is your Krishna.
And Dr. Deepthi signing off. Dhanyavad.